Welcome to the Furthermore podcast.
Sameer, I am so glad to have you on. Why don't you give us an introduction about yourself? Tell us what you do and how you got to where you are, kind of career-wise.
Sure. I am a strategy consultant at a pretty sizable firm called Accenture. I work within that. I work in a practice called Bloom, which is responsible for essentially helping our clients build new businesses. How I got here is a bit of a pretty rocky road, if you will, but really jumping across many different fields. You know, the classic story of starting with dreams of either going into medicine or engineering, trying out engineering, and ultimately deciding that wasn't the best fit for me. And instead, I ended up actually going through finance before landing where I am now in strategy consulting.
Gotcha. Very cool. Very cool. How would you describe maybe your journey from around high school or perhaps prior, coming to those career choices, maybe in terms of a social and cultural perspective? Did you feel the choices that you had in front of you were informed by maybe your upbringing or your environment?
Yeah, surely. I mean, you know, as I'm sure many people who, you know, I personally have parents who, you know, immigrated with, you know, me and my brother in 2006. So at the time I was 12, came in fresh into middle school and, you know, immediately got immersed into this culture. You know, in some ways, because I had moved a lot in my childhood, it wasn't as massive of a transition. But it's still, you know, some of those expectations do carry over. And I think like when it came to my career, the primary thing was, I think, you know, this is probably quite relatable, but, you know, at the end of the day, my parents brought me and my brother here so that we could have a better education and a better opportunity. And that meant looking for careers that were more likely to deliver the rewards that were requisite for that effort. And that meant like, you know, engineering and medicine. I mean, I think, you know, those are careers that are generally considered stable and are likely to generate good, you know, long-term good prospects. Though I think like medicine in some ways has higher prestige in sort of our community, mainly, especially in my family, at least, mainly because, you know, we don't have that many doctors in the family. And there's always that thing of like, you know, if we could have a doctor in the family, that's great. And that would be a point of prestige. But I think that was part of the initial intention, but my parents were generally always like leaving it up to me to ultimately make the decision. It was more of just, hey, here's something that would be nice if it happened. But I think at the end of the day, you know, I chose engineering because I at the time loved programming, and I still do as a hobby and as something that's like a challenging, you know, almost puzzle. I enjoy it, and you know, it became like a personal thing. I started doing a lot of personal projects, and then ended up going to undergrad for computer engineering. And I think like somewhere along the way, I decided, you know, that wasn't exactly the career I wanted. There's a difference, I think, between a hobby and a job.
Right.
And I decided in terms of a career, I wanted something that could take advantage of a broader set of skills, you know, including some of the things that I think are required to build a successful business. And so really the second half of my career, I'd say so far in my relative timeline, has been focused on building that business foundation and ultimately getting more steeped in that world.
Right. No, I hear you. I also resonate with earlier on, you said that your parents really prioritize kind of this medical doctor kind of track. Because my parents, they're both PhD trained, but both of them at certain points in their lives wanted to pursue medicine but could not. I'm not familiar with the system sort of in India for applying to that program, but I think that sort of manifested in me all over again, because a big factor for me deciding the pharmacy career path was sort of a more occupational, like more manageable occupation, let's say lifestyle-wise, than perhaps being a physician. And then you also mentioned the similar kind of environment and circumstances applied to your younger brother. So I'm an only child, and I just want to hear your perspective. Do you think that having a sibling kind of brought up in a similar environment. Did that help in any way? Did that maybe take away? How did it affect your journey? What was that like?
Um, well, my brother, younger brother, and I are about 5.5 years apart.
Okay.
It's a pretty sizable difference. I think maybe it would be different if we were closer to each other. But I think in some ways, sort of me going through the different choices that I have and my parents sort of following along in this context, my younger brother certainly has less of a expectation or pressure to try out any set of careers. Like, I think he's been left to like really figure out for himself, what he wants to do. And I think coincidentally in some ways, maybe it's influenced a bit, but he ended up choosing to do computer science. And now he's, about to go to grad school to do some research in AI.
Excellent. Yeah, I'm happy to hear that. And that sounds okay. I think that makes sense with the age difference. Now, yeah, we can pivot to sort of what you do today for work and sort of the business background. Could you touch on like the sort of healthcare relevance and then what your projects, your perhaps ongoing, current, or recent projects, how they pertain to healthcare and what that involves?
Yeah, absolutely. I actually, didn't start out going into this in healthcare. So when I did, it was sort of bouncing across several different industries. But really, as of last year, in these past 12 months, I've really, really dug into sort of the healthcare side of the world and started to understand just the level of complexity that you have to deal with there.
Yeah.
It began because one of my partners at our company asked me to join this, help out one of our clients who's actually trying to form a startup in the healthcare space.
Yeah.
And it was a bit different for me because when you're outside of that healthcare space, the primary thing you think about is healthcare happens in the hospital. Healthcare happens in certain settings, right?
Yes. Yes.
And but as soon as I went into this startup and started working with them, and this was a serial entrepreneur, somebody who had built many different companies in the space before, and they were explicitly talking about how do you bring healthcare out of the hospital and into the home. Now, for anybody in the space, this is like, it's been happening for a while. It's this thing, there's been a push to move more and more care out of what are especially expensive hospital settings into less expensive and really more convenient settings for the patient or the consumer. So, it was a very eye-opening experience for me, like being steeped in it and really understanding it. And since then, I decided, okay, if I'm going to, commit to any particular industry, it's going to be healthcare. And so for the past year, I've done pretty much projects across the spectrum. One of them was helping build a vaccines platform so that we could distribute drugs more efficiently as their new vaccines are created. So those are sort of my career projects. I think I've started to add on a couple side ones as today I've been thinking about working with sort of a practice and coming up with a social ventures group. And within that, so there's this intersection, I think, a bit of like healthcare as a care and clinical mechanism. And then the world, just when we think about economics and we think about poverty and how those two circles, overlap with each other. So right now I'm working on starting up a project in that space and trying to see like what we can address there.
Excellent.
Especially when we think about like Medicaid population, those who are less, better served once we get outside of sort of the traditional healthcare circle. Excellent.
Very cool. Yeah, no, I think this objective really speaks to me in making healthcare more accessible, especially expanding it outside of the sort of inpatient settings that I think we have a connotation of inpatient settings and certain outpatient settings that don't necessarily correlate with like other places. And do you have sort of any perspective on what factors the big corporate pharmacy chains have into play in terms of maybe promoting and integrating a new pharmacy model? Like does do the big corporate chains have any like factor in the implementation of like a newer, more progressive model perhaps?
Yeah, absolutely. I think there's two major changes happening. One, we're seeing a lot more of the vertical integration in the industry. So, CVS is now pharmacy plus a PBM
Yeah.
plus they bought Aetna, right? And
Yeah.
now they're basically doing all three.
Mhm.
Similarly, there's relationships and acquisitions happening all over the space.
Yeah.
And sort of, I think one outcome of that is every element within the chain is starting to care more about the healthcare costs,
Ah,
the ultimate healthcare costs, beyond just, when you go even beyond the pill into what are the downstream medical costs associated with taking that drug or not taking that drug. And
mhm.
so I think that's one change. And so through that, they're trying to, in some ways improve experience, I think outcomes and lower costs, but also really try and wall off their portion of the market.
Right.
Um, and then on the other side, I think there's a bit of an attempt to change the role of the pharmacist. I've been
Mhm.
learning more about this over the past few months, and I'm sure you may have a bit of a perspective too. It's, when I was working on the vaccines project, like now pharmacists are starting to try and play a bigger role in administering vaccines. Because
Right.
let's be real, you don't need to be like a doctor with many degrees to administer a vaccine.
Right.
It's quite possible for a pharmacist to do so. Similarly, like we're exploring right now, should pharmacists have prescribing capability?
Hmm.
Because the reality is, like, the average person, especially as you get to sort of older ages who are taking multiple medications, they are interacting way more with the pharmacist than they
Yeah.
are with their doctor, right? Because the doctors isn't as available, and the pharmacist just generally is more accessible to them. It's in the neighborhood corner. You don't have to necessarily make an appointment.
Right.
And so there's a lot of changing roles happening. I think it's going to take some time before all that happens, but there's considerations now of like what pieces of what is traditionally considered a physician's role purely can be transferred over to a pharmacist.
Absolutely. Yeah. The pharmacist role is definitely evolving, and it's I think for me, I wanted to join the profession to make an impact, and so far I've been involved in much more non-traditional careers where I've not practiced yet because I'm not sure that personally I'm in a position yet to deliver care, and particularly in an American healthcare system as it's evolving and as it's still kind of becoming more patient-centered and human-centered. Now, what would you advise to perhaps a young person, maybe in their earlier college years, like if they want to make an impact on healthcare? I wonder if there's some decision making involved in sort of should that young person go down a career path where they get a degree of licensure, like myself in pharmacy or in medicine or in nursing, or should they go a different route, perhaps traverse the path that you took where they are in a more of a business space. What do you think about that? Like, sort of, what would be
Yeah,
the ideal way to create impact in terms of choosing a kind of a career path? I guess.
I think those are two different roles that are being played, right? I think it ultimately depends on, I think, a physician or a pharmacist or any provider of care in the system is ultimately filling a more direct role in providing care. Like, and on the other side, I think when we think about the business world, one, it shouldn't be wholly separated from the care, driven world. Because even if you're doing a healthcare startup, for it to be successful, you should have physicians or pharmacists or whatever the relevant provider is on your company, in your company,
Right.
right? And actively making decisions. So I think, the question is, from a business standpoint, or whether you're starting a startup or working within a company, you're thinking about how can I potentially make structural changes to the system? How can I build new business models? How can I change the incentive system so that it's more patient centric or more outcome driven, or more likely to sustain itself given some of the challenging economics? Maybe you're thinking about rural healthcare, or you're thinking about a company like CityBlock, which I think is one of the most innovative companies I've seen recently, that's operating in these urban environments and finding ways to blend sort of low cost care and social services in one package. So I think that there's ways to do that structurally. I think when you think about direct care, I think it's ultimately like a different source of expertise, and I would never claim that I'm able, like, even if I were to launch a successful health startup, I wouldn't claim to say that I'm having the same impact as somebody who's directly delivering care and actually saving lives, right? I think they're different goals, they're different roles. Both are important to the system and the overall process, and it's really up to you of choosing, what do I want to start with? Because that's another point, right? Like, you can always change, right? I could choose today to go and get a medical degree if I wanted. And just as a doctor, going down the traditional path and getting a medicine degree and having the ability to practice, can choose to go and work in a company and drive structural change. So I think nothing means that you're picking a lane, but that you can choose where you want to start getting experience.
Gotcha. I think that's very eloquently put. Yes. And can you remind folks your recent degree or your most recent degree in training was in finance?
Yeah.
Can you talk about that and what that training was like?
Yeah. So after my undergrad in computer engineering, I decided I'd go into finance. And so I got a master's in finance from MIT. It was a 1-year program, very fast-paced, very intense in terms of, I think, just the level of math and technical understanding that was required. But it also opened up my world a lot more, because I think it was an international program for the most part. Like, the bulk of the class was from multiple countries. And I think it was just an opportunity to, like, totally step into a new world of, okay, we've talked about the tech world so far. That's where I lived. I interned at Intel. I interned at, different technology related companies. And now I was working alongside people who I had either worked at investment banks, I had worked at central banks, or were coming from hedge funds, asset management firms. And that was the future, right? That was the next step for the bulk of the class.
Right.
So it was very interesting, different. And I think one thing that did sort of resonate and stick out to me, and that I still like sort of bring forth, like, even to my job today, is one of my favorite professors from school, Andrew Lowe, spent a lot of time focused on behavioral finance. And so for those who are not familiar, the thesis of behavioral finance is economics isn't just everybody behaving rationally, but that there are certain behaviors that are ingrained to how humans make decisions that are different, that vary, that we have to better understand if we're going to, even at not just at a macro scale, but getting down to the level of how do you implement effective programs? How do you fund meaningful research? All those things are relevant when you think about human behavior. And so one of his famous lectures was actually to try and see how we could create a new research model to fund, I believe it was cancer research, where instead of having, pharma companies investing billions of dollars separately, you open up pieces of the market where anybody like you and I can invest in certain types of research. And so I think that it just opened up of, like, it's another tool in my toolkit, right? Like, there's programming, that now there was financial engineering, and over time I've built strategy and all these other things. So it's just another hammer, and I can decide, where to apply it.
Very cool. No, yeah, I think behavioral finance sounds fascinating. That's a term that this might be the first time I've heard it. Those two words put together, and that's very. So I think the last thing I want to touch on is sort of the current ongoing pandemic, the ongoing COVID pandemic, and my question to you would be twofold. How has the pandemic impacted your kind of day-to-day life at work? And the second thing is, does the ongoing pandemic, did that have any impact on sort of any projects coming your way, or any initiatives coming your way within work?
Yeah. I think personally, I've been pretty fortunate where I'm at a job where we're traditionally expected to work outside of our offices,
Okay.
because we're usually at a client site or we're sort of traveling between different places. So for us, immediately everything was remote, and it has been and it will be, I think, through early next year. So we're pretty. I'd say like I'm pretty comfortable. I've come down to Maryland to stay with my parents, and it's great. It's basically like living back when I was in high school, and it's all the right amenities. I think
Yeah.
sort of considering where things could be, this is a pretty good spot. I think in terms of work, a couple things have changed. I think there's been a shift of priorities among a lot of our clients. Before this pandemic started, I was working on a project focused on economic revitalization in the American Midwest.
Mm.
And as you can understand, the very all the objectives we have drastically changed.
Right.
The challenges that existed then, a lot of them have been exacerbated, and new ones have come up. And so our focus has shifted to thinking about how do we properly support recovery and rebuilding in a lot of these communities. And then so within Accenture, at least, Accenture has done quite a bit of, we've launched a work support program so that we can connect people with jobs remotely or otherwise in a lot of different cities. We've done that in partnership with Salesforce. And then we've also launched a COVID-19 accelerator within the firm that's sort of accessible to, I think, pretty much everybody, at least in North America. And anybody can choose to come up with ideas for their local community. And there's like a pretty open and tight network. And every 2 weeks, people come in and apply with like 15 to 20 ideas. They get funded, and then they're going out into their communities and actually implementing them. And so we're trying to find ways that we can help and sort of contribute to the process while sort of, driving what is required for the core business.
Gotcha.
Yeah, I think there's a lot of adaptability going around, and it's in some ways it's shown what is possible.
Yeah, no, I think that's very that demonstrates kind of the responsiveness to the ongoing situation with the pandemic, and certainly being adaptable is I think the way to go. Well, thank you so much, Sameer. I've learned so much from this conversation, and as I always do with any conversation with you, Sameer.
Yeah, well, thanks for having me, Mudit. I'm glad to be on.
Yes, absolutely. So I will place Sameer Bojja's contact info or anything Sameer would like to promote or any words of wisdom Sameer may have in the description. And yes, thank you so much.
All right. Thanks, Mudit.